Hey everyone, my name is Benedict Arnold. Yeah, I know. I don't much like getting stuck with that name, but I bet deep down he was a really nice guy. Anyway, so I live with this super smart human. I call her Amazing Human. She works really hard as a nursing student, but just between me and you, she is a little bit of a stress case. Yeah, always studying, staying up late to get projects and papers done. I really love my human, but I will really be glad when she is done with school. Maybe then she will remember to feed me on a regular basis and at least pay a little attention to me, rather than always study, study, study. Hey, but I have learned a thing or two. She has been working really hard on this PALS class, learning a few drugs, and I picked up some of the basics about drugs used for tachyarrhythmias in kids. I'm a little bored with my human, so busy. I already scratched up the corner of her new sofa. She was so busy she didn't even notice. So I thought I would make a little video about what I've learned while she has been studying. Get a paper and pencil, cause this is good stuff. So you may want to take notes. Ready? The first drug is adenosine. Adenosine is the drug of choice to treat supraventricular tachycardia, SVT for short. It works because it blocks the conduction through the AV node. SVT is a super fast rhythm that starts above the ventricles and involves the AV conduction system. SVT is a rapid, regular rhythm that often appears abruptly and may be episodic. SVT. I wonder if that is what is happening to me when I get the chance to get off this couch and chase after dumb dog next door. Really can't wait for my human to graduate so I can get back to my regular routine of harassing dumb dog. Not that sharing all this info with you isn't fun. If you were a cat, you would understand. Anyway, according to my human, when you give adenosine to pediatric patients, you give a bolus of zero point 0.1 milligrams per kilogram, making sure not to exceed 6 milligrams in the initial dose. If that doesn't work, give a second dose of zero point 0.2 milligrams per kilogram with a maximum dose of 12 milligrams. Adenosine has a very short half-life, less than 10 seconds, so if it is effective, you will know within 15 to 30 seconds after administration when the rhythm converts to sinus rhythm. In order for adenosine to be effective, it must be given as rapidly as possible, followed by a rapid flush. Flush. Sounds good, but it's to get the drug where it needs to be in less than 10 seconds. I'd like to give dumb dog a flush right down the toilet, but that would get rid of him in less than 10 seconds. At least I can dream. It's about all I can do since Amazing Human has to study so much. So, another drug Amazing Human is always going on about is amiodarone. Amiodarone is indicated in treatment for both atrial and ventricular tachyarrhythmias in children. When amiodarone is used, it inhibits both alpha and beta adrenergic receptors, which in turn causes vasodilation and AV nodal suppression, slowing conduction through the AV node. Pediatric patients are given a loading dose of 5 milligrams per kilogram over 20 to 60 minutes, not exceeding 300 milligrams in a single dose. If amiodarone is given too quickly, it can cause hypotension, heart block, or polymorphic VT. Make sure to monitor blood pressure frequently while administering amiodarone. Alpha-beta inhibitor. I might just get dizzy and pass out. How are you all doing? Are you impressed by my brilliance yet? Maybe this will work. Next drug. Let's see. Procainamide. My human said it's the pro at kicking that SVT's butt, so you are going to want to know about it. Procainamide is effective in treating atrial and ventricular arrhythmias, atrial flutter and atrial fibrillation, and can terminate SVT that is resistant to other drugs. When procainamide is given, it blocks sodium channels so it prolongs the prefractory period of both the atria and ventricles, which then depresses the velocity of conduction, prolonging QT, QRS, and PR intervals. During administration, a loading dose of 15 milligrams per kilogram over 30 to 60 minutes is given. It must be given slowly to avoid heart block, hypotension, or polymorphic VT. Make sure you continuously monitor ECG and blood pressure. Monitor. Yeah. Anyway, procainamide. I like the sound of this stuff. I wonder if it could depress the velocity of the heart dumb dog next door. I would love to see his sodium channels blocked so that he can't do anything while in a refractory period. Maybe if I gave it really fast. But you know what my life is like right now. No fun. Just a bunch of watching my amazing human study. Good thing she's almost done. She's been working so hard. She talks a lot about lidocaine. What's up with all these drugs that have cane in them? Too close to canine for me. Anyway, this lidocaine stuff is pretty cool, and I hear her talk about it being used for a lot of stuff. But here is what I have heard her say about it when she is studying for that PALS class. Lidocaine is an alternative treatment for VT, but it is not effective on supraventricular arrhythmias. Lidocaine is a sodium channel blocker that suppresses wide complex ventricular arrhythmias. A loading bolus of 1 milligram per kilogram is administered by giving 20 to 50 micrograms per kilogram per minute. Oh yeah. Ventricular tachycardia. I bet my heart rate is going to be over 120 next time I see dumb dog and make chase. I'm so out of shape from all this sitting around, since all amazing human does is study. Poor girl. All those assignments and special projects. She doesn't even have a P wave for me anymore. And her T wave goes down rather than up now, and she is getting a wide complex. Yes, I said complex, not buttocks. But just between you and me, the other is getting a little wide too. I hope she isn't getting this VT thing. She's running around pretty fast when I do get to see her. This has been a lot of fun, but my amazing human will be home soon, so only time for one last drug. Hope you haven't fallen asleep. If you have, wake up! You're going to want to hear this. Oh, hairball. Magnesium sulfate. Yes, magnesium sulfate is used to treat torsades de pointe, or VT with hypomagnesemia, and is given IV or IO as a dose of 25 to 50 milligrams per kilogram over 10 to 20 minutes. Make sure not to exceed 2 grams. Torsades de pointe sounds pretty fancy, kind of like twisting of the point in ballet. But Amazing Human gets a sad face when she talks about it, so it must be pretty bad. She said something about kids that are born with long QT syndrome. I hope Amazing Human doesn't have that too. She has had a lot of syndromes since starting nursing school. Well, this has been fun, but I hear Amazing Human coming now. Hope you all learned by me sharing my vast knowledge of medications you could use on a poor kid that has tachyarrhythmia. I hope Amazing Human and all the rest of you stressed out nursing students do well on your PALS test. Meow.